What is bladder nerve stimulation, and how does it work? Bladder nerve stimulation is a medical treatment that uses mild electrical impulses to stimulate specific nerves that control bladder function. The primary focus is on the sacral nerves located near the lower spine. This stimulation helps improve communication between the brain and the bladder, leading to better control over bladder storage and emptying functions. The most common form of bladder nerve stimulation is sacral nerve stimulation, also known as sacral neuromodulation. In this procedure, a small device is surgically implanted near the sacral nerves, which are responsible for the bladder, bowel, and pelvic floor muscles. This device delivers mild electrical pulses to these nerves, modulating the nerve signals involved in bladder control. As a result, it can reduce symptoms such as urinary urgency, frequency, incontinence, and urinary retention by normalizing the nerve reflexes that regulate bladder filling and emptying. The sacral nerves act as messengers between the bladder and the brain. They signal when the bladder is full and needs to be emptied. When these nerves malfunction due to injury, disease, or other causes, bladder control problems can arise. Electrical stimulation through sacral nerve stimulation helps restore proper signaling pathways, allowing the brain to better sense bladder fullness and coordinate timely voiding. The procedure typically occurs in 2 stages under anesthesia. First, there is a test phase to assess if stimulation improves symptoms. If successful, a permanent implant is placed. Besides local effects on the sacral nerves, sacral nerve stimulation may also influence higher brain centers involved in bladder control, although the exact mechanisms are not fully understood. Another related technique is percutaneous tibial nerve stimulation, which is a less invasive, non-surgical treatment. This method stimulates the tibial nerve near the ankle. The tibial nerve connects to the sacral nerve roots, and its stimulation indirectly modulates bladder nerve signals to reduce overactive bladder symptoms. From a bladder health perspective, nerve stimulation is an important option for patients with refractory bladder dysfunction. This includes those with overactive bladder, urinary retention, or incontinence, especially when conventional treatments have failed. It is generally considered safe and effective but requires careful patient selection and medical supervision. For patients with bladder cancer, bladder nerve stimulation is not a treatment for the cancer itself. However, it may be relevant if bladder function is impaired due to surgery, radiation, or other treatments affecting the bladder or pelvic nerves. In such cases, nerve stimulation might help manage bladder control symptoms and improve quality of life. In summary, bladder nerve stimulation works by electrically modulating the sacral nerves to restore balanced communication between the bladder and brain. This process improves bladder control and reduces symptoms of bladder dysfunction. It is a clinically established therapy used under medical guidance for certain bladder health conditions. Always consult healthcare professionals for personalized medical advice regarding treatment options.